Good afternoon. Bonjour à tous et à toutes. As COVID-19 rages all around us outside of the Atlantic bubble, we must make every effort to slow its spread in New Brunswick and throughout the Atlantic bubble. Yesterday, our cabinet approved recommendations to move Zone 1, which is the Moncton region, back to the orange phase of recovery. Today, I have recommended that Zone 2, which is the St. John region, also transition to the orange phase. The number of COVID-19 cases in Zone 2 has doubled in the last 2 days, with 7 new cases today. We are seeing transmission in community settings in the zone, including recreational facilities, healthcare and long-term care institutions. Hier, le cabinet a approuvé notre recommandation de faire passer la zone 1, soit la région de Moncton, à la phase orange du rétablissement. Aujourd'hui, je recommande que la zone 2, soit la région de Saint-Jean, passe aussi à la phase orange. Le nombre de cas de COVID-19 dans la zone 2 a doublé au cours des 2 derniers jours. 7 nouveaux cas étant signalés aujourd'hui. Nous avons constaté des cas de transmission en milieu communautaire dans cette zone, dont des établissements de loisirs, de soins de santé et de soins de longue durée. Today, Public Health has declared a COVID-19 outbreak at Shannex Tucker Hall, an adult residential facility in St. John. Following a confirmed case of COVID-19 on Thursday, Public Health started an investigation at the facility. Contact tracing has commenced, and officials will conduct testing of the facility's residents and staff today. Although there are only 90 residents at Tucker Hall, all 422 residents and staff from the entire Parkland St. John campus are being tested today. It is vitally important that everyone in Zone 2 reduce their close contacts and follow all public health guidance. This is not the time for large public gatherings. Limit your contacts with others to a consistent group of close family and friends. Please avoid non-essential travel into or out of Zones 1 and Zone 2 that are now in the orange phase. For all New Brunswickers, I urge you to monitor your health. Even if you have the sniffles, do not assume that it's a garden variety cold. Stay at home and get tested for COVID-19. These restrictions are needed so that we can effectively manage these outbreaks and bring these zones back into the yellow phase of recovery as quickly as possible. Aujourd'hui, il y a 9 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Les nouveaux cas sont les suivants. Il y a 2 nouveaux cas dans la zone 1, soit la région de Moncton. Une personne de moins de 19 ans, une personne âgée entre 20 et 29 ans. Il y a 7 nouveaux cas dans la zone 2, soit la région de Saint-Jean. Une personne âgée entre 20 et 29 ans. 3 personnes âgées entre 40 et 49 ans. Une personne âgée entre 50 et 59 ans. Une personne âgée entre 60 et 69 ans. Une personne âgée entre 70 et 79 ans. Tous ces cas font présentement l'objet d'une enquête menée par la santé publique. Il y a maintenant 51 cas actifs au Nouveau-Brunswick et une personne ayant contracté le virus est présentement hospitalisée. Il est vrai que nos statistiques sont inférieures à celles signalées dans les nombreuses autres administrations au Canada, mais nous ne devons pas faire preuve de relâchement. Today, there are 9 new cases of COVID-19 in New Brunswick, and the new cases are as follows. In Zone 1, which is the Moncton region, there are 2 new cases, 1 individual under the age of 19 and 1 individual aged 20 to 29. In Zone 2, which is the St. John region, there are 7 new cases, 1 individual aged 20 to 29, 3 individuals aged 40 to 49, 1 individual aged 50 to 59, 1 individual aged 60 to 69, and 1 individual aged 70 to 79. All these new cases are currently under investigation by Public Health. We now have 51 active cases in New Brunswick, including 1 individual now in hospital. It is true that our numbers remain low in comparison with many jurisdictions in Canada, but that is no cause for complacency. This is a virus that spreads exponentially if unchecked. Now is the time to protect our Atlantic bubble and maintain the record for which we are widely envied across Canada and around the world. And the best way for us to do this is for everyone to limit their close contacts. In zones now at the orange phase, we are directing that people limit their contacts to their single-family bubble. And that means the people that you live with, Your one household bubble includes the people that you live with. It can be extended to caregivers or an immediate family member who lives alone and requires support. The objective is to keep your circle of contacts small. There are currently about 600 people at least who are self-isolating in New Brunswick currently from different cases that have been traced in terms of contacts. And I'm sure that every single one of them wishes that they weren't at home for the next 2 weeks, and I'm sure that many of them wishes that they had not been exposed to COVID-19. We have a lot of work to do starting right now. La bulle formée d'un seul ménage inclut les personnes avec qui vous vivez et peut être élargie aux aidants ou aux membres de la famille immédiate qui ont besoin de soutien. L'objectif est de réduire au minimum votre nombre de contacts étroits. This restriction does not apply in the yellow phase zones, but I strongly recommend that everyone limit their close contacts to the greatest extent possible. And as I have said before, the best approach is to assume that everyone may have the COVID-19 virus and act accordingly. I also recommend that everyone in New Brunswick, no matter where you live, have a contingency plan ready if you are required to self-isolate. Just like EMO puts out advice around making sure you have 72 hours worth of emergency food and water, et cetera, if there's a power outage. You need to be prepared to self-isolate for 2 whole weeks. Make sure you know who to call on to pick up your groceries and other supplies, manage your businesses, look after your summer camp. Taking this precaution ahead of time will make the transition easier for you and those who rely on you. And I do understand that it's frustrating because I think nobody expects to be exposed to COVID-19 because we have been living relatively free of the virus in New Brunswick. So I think it is easy for people to think that we're immune to COVID-19 here in the Atlantic bubble, but we are not. So as frustrating as it is, please continue to be kind. Please continue to be compassionate. We are all doing our best. Guidance in the yellow phase zones has been changed to permit indoor gatherings of up to 20 people. Holiday parties and gatherings may proceed on this basis, but everyone should remember to keep these events to a consistent group of family and friends. Far too frequently, we have seen COVID-19 spread through contacts at casual social gatherings. I think people need to have a higher level of comfort saying no to going to these gatherings. When somebody invites you to these gatherings, please take the time to make a very conscious choice. And if you need to say no, please do so. And have a rehearsed line that you might have to bring out to practice and make sure that you're comfortable setting that boundary. This year, we must take new precautions to meet the reality of the pandemic. Holiday shopping can proceed, but with some changes. I suggest that people plan their shopping differently this year to shop during low traffic periods and avoid large crowds. Business owners can help by spacing out their sales events. And again, I want to emphasize that people should avoid non-essential travel into or out of the orange phase zones, but this holds true for the entire Atlantic bubble. I did hear that somebody was confused about what I was saying yesterday about traveling, and so when I'm talking about non-essential travel inside and outside the orange zones, that's for what we're experiencing right now in terms of dealing with these outbreaks. But in a general sense, traveling outside the Atlantic bubble or traveling outside of the Atlantic bubble for non-essential reasons or having people travel into the Atlantic bubble for non-essential reasons is discouraged at this time. Encore une fois, je tiens à souligner qu'il faut éviter d'entrer ou de sortir d'une zone orange pour tout déplacement non essentiel. The holiday season can be just as joyful as ever if we approach our situation with an open mind and an open heart. I also want to speak today about the processes that public health uses to alert people about possible exposure to COVID-19. And we have been asked many questions about this also. In every instance, our objective is to reach people who may have been exposed to the virus so that they can take action to slow the spread of the disease. We target our notification based on the likely opportunity of exposure. We will alert the broader public when people from a wider area may have been exposed, for instance, on an airplane or in a large shopping mall. Other examples we've seen were in an optical center, Tim Hortons, et cetera, or McDonald's. So in cases where businesses' customers are more likely to be local, we may advise an owner in the course of tracing contacts, just as we would with any institution or organization. Les personnes qui font la recherche des contacts jouent un rôle primordial pour ralentir la propagation de la COVID-19 et je leur suis très reconnaissante pour les efforts inlassables qu'elles déploient. Il ne s'agit pas d'un travail qui est toujours facile. Bien que la plupart des gens font preuve de la collaboration, il arrive que les membres du personnel chargés de la recherche des contacts sont traités de façon grossière, même s'ils ne font qu'effectuer leur travail. And sometimes organizations, businesses, etc., will put out messaging of their own, and then the public is confused about, well, it didn't come from public health, but this facility or this organization or this business has put out an alert. The alerts that you need to be aware of are the ones that public health issues. They are on our website, and those are the ones that from a public health perspective, where we are aware of contact tracing that was done, and that we were notified that through our contact tracing, that there may have been people that we might have missed. If we are confident that we haven't missed people, then we won't be issuing a public exposure notice. And I want to assure New Brunswickers that our staff will continue to strive for a high standard of professionalism and care performing their duties. Even at our borders, you know, our public safety employees have been there for months and months and months, and they are doing a great job, and they will continue to do a great job. But everybody is working their hardest. Everybody is working really hard to do their best and make sure that we're protecting the population of New Brunswick, and we need everybody's cooperation. And we need everybody's compassion and patience. We are all working to prevent the spread of COVID-19 while respecting individual privacy and other rights of New Brunswickers. Thank you very much.
Bonjour. We are continuing to see an increased number of cases of COVID-19 in the province, especially today in Zone 2, the St. John region. Because of this, the All-Party Cabinet Committee on COVID-19 and Cabinet have accepted the recommendation of Public Health and have made the decision to move Zone 2 to the orange level, effective as of midnight tonight. Currently, there are approximately 300 people self-isolating in the St. John region, and this number is expected to rise. It is important to note that if we can't get the numbers under control quickly in the St. John region, we may need to move it to the red level when necessary. Je réalise qu'une quantité importante d'informations a été communiquée hier au sujet des changements de phase. Les changements recommandés par la santé publique visent à trouver un juste équilibre entre la santé et la sécurité de la population. Those in the orange zones, residents in Zone 1, the Moncton region, and residents in Zone 2, the St. John region, must stay within a single household bubble. A single household bubble is limited to the people who live in your house with you. Under the orange level, a single household bubble can be extended to caregivers or to an immediate family member requiring support. No informal gatherings outside of this single household bubble are permitted. Formal gatherings of up to 25 people are allowed for weddings, funerals, and faith-based services with an operational plan in place. Faith venues may hold in-person services with up to 50 participants with 2 meters of distancing. Everyone wears a mask and no singing. Les salles à manger des restaurants peuvent demeurer ouvertes. Cependant, il faut continuer à respecter les consignes de la boule formée d'un seul ménage lorsque vous sortez manger. Les entreprises de services personnels, comme les salons de coiffure et les professionnels et de la santé non réglementés, peuvent continuer à exercer leur activité, mais elles doivent avoir un plan opérationnel en place. Entertainment venues can stay open as per their operational plan, but limiting occupancy to 50. Venues such as gyms and fitness centers are allowed to stay open as long as they are operating safely as per their operational plan, with additional mitigation strategies. Sports teams must limit their activities to practices within a single team. Les services de transport en commun peuvent continuer à être offerts, mais les passagers doivent maintenir une distance d'1 mètre les uns d'autres et porter un masque. I know we've given out a lot of information, but if you're looking for specifics, you can go to our website, www.gnb.ca/coronavirus, and click on Recovery Plan to see what's new at each level. Throughout this pandemic, we have made changes as new information has become available, and all decisions have been made on the advice of public health. We understand that you are concerned by the increased number of cases in this province, and so are we. We share your concerns, and that is why we're asking all New Brunswickers to take what is happening seriously. We have seen areas where there have been fundraisers, social events, household, and other gatherings with way too many people, no social distancing, and no face masks. Too often, people are gathering with one group at one night and completely a different group another night. This has led to the situation we are currently in, and we need to take responsibility for that. I'm calling on all businesses, especially the ones where people gather, such as restaurants, bars, coffee shops, cinemas, and shopping venues, to do everything they can to follow the directions of public health. It's important that we continue to keep businesses open wherever possible, but in order to be able to do that, we need to be sure that the protocols are being followed and a plan is in place that keeps patrons safe. We also want to encourage patrons. We want to encourage people to support local businesses because it's important. It's important for our economy. It's important that we continue to operate as normally as possible. But we cannot do so when mass gatherings are threatening us moving tighter and tighter controls in order to push back and keep our curve flattened. We want to be able to return to both Zone 1 in Moncton region and Zone 2 in the St. John region. We want to return to yellow level as soon as possible. C'est notre but constant, permettre aux citoyens de demeurer dans la région, tout en assurant autant que possible leur santé et leur sécurité, jusqu'à ce qu'un vaccin devienne largement accessible. We need to do everything within our power to ensure that no other regions have to move to orange level, or that any regions move to red level in the coming days. Each of you have an important role to play in that. In fact, I can't stress this enough. It is the actions taken on the individual level that will make all the difference in how well we stay ahead of this pandemic. Il est important que nous fassions tout un effort pour limiter autant que possible le nombre de nos contacts étroits. The holidays are approaching quickly, and this year, as heartbreaking as it may be, we must limit our gatherings and keep our contact numbers as low as possible. This is also important advice to keep in mind in the lead up to the season as holiday shopping ramps up. Black Friday is coming up next week, and under normal circumstances, this would be an opportunity for stores to offer big one-day sales. It is crucial that we continue to reopen our economy, but we cannot risk the health of New Brunswick in doing so. But I also want to encourage business owners to spread out their sales if possible to avoid large numbers of customers shopping on a single day. I also want shoppers to continue to enjoy the shopping event in a health and new safety way. It's important that we support our local businesses, but we can do that in a way that ensures that we maintain our health standards, we flatten the curve, and we also keep our economy and our businesses open. J'encourage également les citoyens à adapter leurs habitudes de magasinage autant que possible. Évitez les heures de pointe. Revenez plus tard si un magasin est bondé de monde et vérifiez les produits sont offerts en ligne ou par courrier sur place. Of course, we must all continue to follow safety guidelines like wearing a mask and maintaining 2 meters of physical distance from others when we're in public. It's not one or the other. Do both to increase our defenses against the virus. De nombreuses entreprises ont fait de l'excellent travail en matière d'affichage. Par exemple, des flèches pour que les clients évitent autant que possible d'entrer en contact avec les autres. Veuillez porter attention à ces fiches et respecter les règles. This is the best way to protect yourself and everyone around you. We're going to see more cases of COVID-19 in the coming days, but we want to be able to manage these cases so we don't overwhelm our hospitals and our health professionals. While increased cases is expected, we must continue to do everything we can to slow the spread of the virus. It is imperative that we continue to work together to keep each other safe and to move our entire province back to yellow as quickly as possible. We can do this. Think about what you were doing last week. Think about what you've been doing in the last few weeks, and think about how that impacts the health of yourself or the health of others. And were you doing your part to protect the health? I've said it many times here before. This isn't about being able to enforce these rules. This is about everyone understanding the rules, being part of the solution to ensure that we have a healthy and safe Christmas season, and we move safely into the time when a vaccine is available. Thank you. Merci.
Merci beaucoup, Monsieur le Premier ministre. Dr. Russell, thank you, Premier. Thank you, Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Chaque journaliste peut poser une question. We'll now proceed with questions from members of the media. You have the right to pose your question in the language of your choice, and each reporter will have one question today. Natalie Sturgeon, Telegraph-Journal.
Thanks, Bruce. My question is for Dr. Russell. You declared an outbreak at Tucker Hall at the Shannock's Parkland St. John, and I'm just wondering whether that case is connected to a medical professional, and of those 300 people that are now self-isolating, how many of those are medical professionals?
I don't have exact numbers on how many are healthcare workers, and I can't speak to whether the person who tested positive at the Shannocks is a healthcare worker or a staff member, or a resident, rather.
Okay. Thank you. Savannah Odd, Telegraph-Journal.
Hi there. My question is for the Premier. Today, we saw a bit of an interruption in the sitting in the legislature, and we're told that it was discussed, I guess, what will happen next week in terms of, how people will sit. Will it be virtual? Will it be hybrid? Leaders are telling us they don't know the answer to that question. There seems to be a lot of confusion. Is there a plan for what is going to happen with the legislature? Is there a contingency plan if we continue to see these outbreaks? And I guess, what is the plan for next week?
So right now we have I guess the one consideration is in relation to the public health requirements that we would be staying in the zones that are affected, the orange zones, and particularly now we have 2. So that will limit the number of people that would actually be coming to the legislature. However, the legislature can continue to operate with a reduced number of MLAs actually present who are living or staying outside of the affected zones. So that is a debate that's underway right now in order to determine if the Speaker will allow the ledge to remain open under reduced numbers and feel that they can do that safely, meeting the health rules, which I would guess that will be permitted because we were operating before under the health rules with a larger number. The option, the only other 2 options aside from running with reduced staff and reduce the MLA participation, which we can to meet quorum, would be to suspend the House for the next couple weeks until we see what happens in these zones, We are not equipped to run the House virtually at this point, and that will be a decision with LAC. There hasn't been any proposals made to put it into that sort of a position like the federal government is at this stage. And I don't know if any other provinces are doing that at this point either. However, if this becomes a prolonged issue, then that has to be an option which the legislature will consider, and I would say make a proposal to the government, and we would be making some modifications to our capabilities.
Thank you, Premier. Thank you, Ms. Ott. Pascal Rochenock, l'Acadie Nouvelle.
Oui, bonjour. Ma question est pour la Dr. Russell. Le premier ministre, tantôt, a mentionné que si les cas dans la région de Saint-Jean ne sont pas contrôlés rapidement, la région pourrait régresser en phase rouge. Je me demande combien proche est-ce que la région de Saint-Jean est de la phase rouge? Qu'est-ce qui pourrait pousser la santé publique à recommander une régression pour la zone 2?
Alors, pour les éclosions qu'on a vécues déjà dans la zone 5 et celui qu'on a déjà vécu dans la zone 1, les déclencheurs sont vraiment dans la catégorie de le nombre de cas qui a doublé entre un tel nombre de jours. Et les éclosions dans des endroits avec des populations vulnérables. Alors, on a ces deux déclencheurs-là. L'effet qu'on n'a pas vraiment la coopération de tous les membres du public au niveau de s'assurer que les gens portent leur masque ou ils sont dans des endroits ou des rassemblements peut-être qui sont moins sécuritaires et aussi avec les rassemblements et aussi avec les recommandations sur le rapportage le numéro de téléphone et les noms pour des restaurants, les choses comme ça. Si c'est pas fourni, ça veut dire que faire le traçage de contact étroit, c'est difficile quand il y a des éclosions qui impliquent des endroits comme cela. Et l'autre catégorie de déclencheurs, c'est quelque chose qu'on suit vraiment. Il y avait une question demandant s'il y avait des travailleurs de santé qui étaient impliqués. C'est vrai qu'il y a des travailleurs de santé impliqués dans l'éclosion de zone 2. C'est aussi le cas dans la zone 1. Alors, on va surveiller la situation pour déterminer s'il y a encore des déclencheurs dans cette catégorie-là sur l'effet de les nombres de personnes qui vont être hospitalisées, etc., s'il y a de la capacité. Mais celui qu'on est un peu... qui est concernant à ce moment-ci, c'est le nombre de travailleurs de santé qui sont impliqués et aussi s'il y en a parmi eux qui peut-être va causer un défi au niveau de continuer à offrir des services de santé dans les prochains jours et semaines. Parce que même s'il y a quelqu'un qui n'est pas positif, s'ils sont en auto-isolement pour les prochains 14 jours, ça veut dire qu'il ne peut pas fournir des services de santé. Alors, ça aura un impact, mais on va continuer à analyser cette situation. Puis si c'est nécessaire d'aller dans la phase rouge, on va le faire certainement, mais ça va être après qu'on a l'information et la surveillance pour dire que oui, c'est déterminé par ces déclencheurs ici.
Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier. Premier Higgs, just to clarify from yesterday, is it now mandatory for Campobello Island residents who get gas or essentials in the United States to isolate for 14 days? If so, what motivated that change? And are you aware that St. Stephen is over 80 kilometers away from the island?
Yes, I'm quite aware of the distance. It's been that same distance for a lot of years. The idea no, there's nothing's changed in terms of their movement into Maine and back. We want them to be as normal as they were before. That's the goal. And I asked, as I said yesterday, is how do we ensure that life is the same and or as similar? We are encouraging, however, that they would minimize any stops in Maine and go directly through to St. Stephen or back. That would be the safest thing to do. And I have asked our public safety folks to work with border guards and officials. So we do have continuity there of what's being offered. And if I find some, let's say, situations that we can't manage or haven't been managed properly, then we will work with the residents and the officials to fix that, to remedy that.
Thank you, Premier. Thank you, Ms. Hogarth. Nicholas Steinbach. Callum Smith, Global News.
Thanks, Bruce. My question is for Dr. Russell. Doctor, I've seen a lot of people voice concern about the single household bubble, but be able to go to a bar and see their neighbors from a distance. How are the decisions made to keep what seems to be all businesses open while tightening the household requirements?
Well, what we're seeing in terms of the transmission patterns is people who are gathering, whether it's in a home or whether it's in a private function, we are seeing the transmission patterns mostly outside of these types of settings. So, and in the cases where transmission has happened in that type of setting, again, if we're able to trace the close contacts, then at this point in time, that is what we are doing. And when we can't do that, then we issue public notices about possible exposures. But again, we take the information and we analyze it, and we are constantly revising our approach and constantly revising our phases to reflect the risks, to reflect the information that we receive around transmission patterns in the province.
Thank you, Doctor. Thank you, Mr. Smith. Geneviève Normand, Radio-Canada.
Yes, my question is for Premier Higgs. Next week, it's going to be 8 months since the closure of the borders, and I was wondering if you are satisfied the way things are as of right now.
So I'm not sure I understand the question.
Yeah, of course. So it's been 8 months since the borders were closed, and I was wondering if you are satisfied with the measures that are in place to limit the spread of COVID-19, and in fact, if you think the borders should remain closed for a number of months still.
Oh, yes, I do indeed think the border should remain closed, and we continue the diligence there that we have been and strengthen it wherever we can in that sense. I guess what we are seeing is what is having an ongoing impact is the regular travel for essential service and employment that is happening routinely, and that's why changes were made here this week in relation, and in the past weeks, in relation to the testing of travelers, because we were still finding that activity in the community was still there, and despite the timelines for isolation were not hadn't gone to 10 to 14 days. So the border controls need to remain. The U.S. border connection and the way that that's being managed with the federal government in terms of its enforcement needs to stay. And we're heightening up our testing in order to protect against those that we know are traveling and make it ensure that they remain safe when they get home and don't transmit the virus to anyone else.
Thank you. Merci beaucoup, Mademoiselle Normand. Dr. Russell, Callum, are you still there? Dr. Russell has some more information for you.
That'd be great.
Hi, sorry, the answer to that question is actually in restaurants and those types of situations, in the orange phase, you're not actually allowed to go to those establishments and sit with anybody but the people in your household bubble. So your question around going to a pub or a restaurant and meeting your friends, et cetera, that's not okay in the orange phase. You can only be seated with your household bubble members.
Thank you, Doctor. Thank you, Mr. Smith. Adam Harris, Telegraph Journal.
Thanks, Bruce. To both the Premier and Dr. Russell, roughly 25% of New Brunswick's COVID cases are New Brunswickers who traveled outside of Canada and brought the virus back. Yet New Brunswick still has a lot of snowbirds contemplating a trip south. I was hoping you could address them today. Should they go? If they do, what should they know? And are you working on any different requirements for their eventual return?
The Premier may have a different answer than I have, so he may want to comment after I do. Without question, a pandemic is not the time to make any non-essential travel plans, period. That is my answer.
So since we, continue to tag team in our communication, and we're certainly been fully aligned here, I would certainly concur that if we were looking at where's the safest place to be, I don't think I'd pick Florida or the South. And so right now, I would discourage if someone was planning to go south, I might hold off on that just a little longer and wait for a vaccine.
Thank you, Mr. Harris. Laura Lyle, CTV.
Hi, my question is for Dr. Russell. Dr. Russell, at what point would you consider doing mass testing in the St. John region and the Moncton region?
Well, we are having conversations right now about making sure that we have capacity to meet the demand as it is right now. In other outbreak situations, we have done mass testing. For the time being, we're doing the mass testing in the Shanix Parkland Estates facility. And if there is any other involved institutions, then we'd be doing testing in those types of areas. But the conversations are ongoing about what other opportunities that people will have to get tested. But at this moment in time, if anybody has any one of the symptoms on the list, they can call 811 or they can do the online assessment form and get tested at this moment in time.
Thank you, Ms. Lyle. Thank you, Dr. Bobby Jean McKinnon, CBC.
Yes, thank you. My question is for Dr. Russell. I think you might have covered this a bit with Luckady and Nubel's question, but putting St. John back to the orange level may seem extreme to some people when there are only 14 cases right now. Moncton had 24 cases before you bumped it back to orange yesterday and 21 before you bumped it back to orange in October. Can you just please explain why you're taking this step now?
The contact tracing has revealed that some of the spread is happening in areas, number one, where there is a super spreader event, and there are some super spreaders involved in some of the cases. So we are expecting more cases to pop up, and the fact that there are so many healthcare workers involved at this moment in time who are self-isolating. And again, with the contact tracing that we've done and the type of contacts that we have found and those people who are self-isolating as a result, we expect many of them to become positive. But in terms of the triggers have been met. So the triggers are doubling time within a 6-day period, and that has happened. The other trigger is the number of healthcare workers that are affected currently. And the other is the fact that people have not been following public health protocols and advice around physical distancing, keeping their close contact numbers low, wearing their masks, et cetera. So we are seeing all the triggers that we used in the Zone 5 outbreak, in the Zone 1 outbreak. They're quite similar with the exception of again, the impact on the healthcare workers. The fact that in St. John, a very large nursing home is involved at this point in time and doing all that contact tracing and testing at this moment in time. Again, there's a huge risk there. So vulnerable population being affected is one of the triggers. So the triggers haven't changed. The criteria have been met to move to orange in the Zone 2.
Thank you, Doctor. Thank you, Ms. McKinnon. Sophie Desautels, Radio-Canada.
Oui, bonjour. Ma question est pour le Dr. Russell. J'aimerais qu'il y a beaucoup de gens qui nous ont posé la question dans le public, pourquoi réduire la bulle à un seul ménage alors que, par exemple, les élèves, les enfants continuent à avoir de nombreux contacts à l'école, à la garderie, dans les sports interscolaires et qu'ils ramènent ces contacts-là à la maison?
Alors, je comprends la question. C'est vraiment l'effet d'essayer de réduire les risques. Les risques seront jamais zéro, mais on veut que les enfants soient capables d'aller à l'école. Ça, c'est vraiment important. Toutes nos conversations avec les autres médecins hygiénistes, avec toutes les autres provinces, sont en accord que c'est vraiment, vraiment important de faire certain qu'on qu'on puisse permettre les enfants à aller à l'école. Alors, on ne veut pas changer ça. Les risques sont diminués le plus bas que possible à l'école dès que maintenant. Pour les rassemblements, les gens qui vont qui vont passer du temps avec des gens hors de leur maison, ça, c'est pas absolument nécessaire, sauf que s'il y a quelqu'un qui prend soin de quelqu'un d'autre, les choses comme ça. Alors, c'est vraiment l'effet qu'on veut diminuer les risques le plus bas que possible pour protéger les entreprises, pour protéger les écoles et protéger les hôpitaux et les travailleurs de santé.
Merci, docteur. Merci, mademoiselle des hôtels. Inda NTR, Huddle.
Hi, this is a question for the Premier. Premier, there's two zones in Brunswick that's in orange, and Nova Scotia is also experiencing a community spread. So I was wondering how soon could we see changes to the Atlantic bubble?
Well, certainly, I would I dare say the public health officials internally have been discussing. I know I've had some conversations with Premier King in relation to what they're doing there in PEI. At this stage of the game, it would more likely be PEI who would look at, if they should reinforce their borders, and as we're experiencing similar situations in Nova Scotia and New Brunswick. Newfoundland's seen a bit of an increase as well. So we haven't had any discussions about the bubble changing at this phase, but I would anticipate you'd see some maybe minor tweaking within the individual provinces on border controls. And doesn't necessarily change the whole bubble, but it likely will cause some strengthening at individual borders.
Thank you, Premier. Thank you, Linda. Thank you. François Leblanc, Radio-Canada.
Oui, bonjour. Question pour le Dr Russell. Ce serait pour parler des CIDOC de Saint-Jean qui ont fait une mise à jour là, sur leur membre de personnel qui a été déclaré positif.
Je n'ai pas entendu la question. Tu répéter la question, s'il vous plaît?
Oui. Donc, c'est un membre des CIDOC de Saint-Jean. Les CIDOC de Saint-Jean ont fait une mise à jour sur le membre de leur personnel qui a été déclaré positif à la COVID-19. Ce qui est intéressant, c'est que dans le communiqué, on nous dit que le membre du personnel s'est senti mal et a subi un test la semaine dernière. Mais lorsqu'on regarde l'horaire, les CIDOC ont joué contre Moncton a joué contre Acadie Batters, les CIDOC ont joué contre Halifax. Je veux juste que vous nous parliez du niveau de risque de la transmission envers ces équipes-là. Est-ce que vous allez demander à la Ligue de mettre fin à ces activités, d'arrêter leurs activités du moins au Nouveau-Brunswick? Est-ce que vous allez parler à la Ligue bientôt?
Moi, je ne peux pas faire des commentaires sur des cas individuels, mais en général, si les situations changent et on a des risques qui changent, il y avait eu une conversation aujourd'hui, je crois, avec les organismes de hockey. Et la dernière fois que j'ai parlé avec mes collègues, les médecins hygiénistes en chef en Nouvelle-Écosse et aussi en l'île du Prince-Édouard, parce qu'on voyait que les risques augmentaient, il y avait une discussion sur si oui ou non les équipes devraient voyager entre les provinces pour continuer à jouer, mais une décision n'a pas été faite jusqu'à maintenant, mais c'est quelque chose qui a été discuté à cause des risques qui augmentent.
Merci, M. Leblanc. Merci, Dr. Trevor McNally, Tribune.
Thanks, Bruce. This question is for the Premier. Under the previous orange phase, hairdressers, barbers, tattoo shops were forced to close. I'm just wondering, when were the changes made to allow for these businesses to remain open in the orange phase, and will they be, I guess that's...
Hi, I'm going to take that question. So our phases have been continually revised based on what we're seeing in terms of transmission patterns, evidence, and data. So our original phases with respect to red, orange, yellow were a certain set of protocols, and then we revised them in the summer. And then prior to the outbreak in Zone 5, we had planned to do another revision, but obviously got sidetracked by the outbreak. But we certainly had made the plan to change the phases again based on risk, based on evidence, based on changes and the evolution of the pandemic, so we could reflect the correct and targeted mitigation for the risks that we were seeing as things have evolved. So, and we will continue to do that. So there could be more changes in the future. But at the time that the outbreak happened in Zone 5, again, we're always continuously looking at revising all of the information in those phases.
Thank you, Mr. McNally. Marie Sutherland, CBC.
Hi, yes, good afternoon. My question's for Premier Higgs. Prime Minister Trudeau today urged Canadians to follow public health rules to contain the spike in COVID-19 cases. And you've also made it very clear today that individuals have to do their part. And you've seen cases of people not following public health protocols. So I'm wondering, given this rising threat, is it enough to ask people to take preventative measures? Would you be increasing monitoring in orange zones, increasing fines and penalties in these zones for people who don't abide by the rules?
Yes, and I think in all counts, we have to continue the monitoring, and we have to really go after the major infractions. I mean, if there's a dinner party with 100 people, that's a major infraction. And I think, you know, while you say, how do you manage with so many people violating the rules? You know, it is a time that we are asking people to really look at their behavior. And I know it's difficult, and I know it's frustrating, but we're so close. So we will be monitoring more, and we will issue fines and if necessary. But, you know, my point has always been, we can never hope that we're going to catch anybody, and no one should feel like they won something because they actually beat the rules. Because I am sure you know, in this case and the way that the transmission has happened in the St. John area over this last several days, no one should feel good about that. No one does, I'm sure. But at the time, it didn't seem like it was an issue. Well, it is an issue, and we'll never catch everyone, nor will we try. But we really want people to pay attention and help us here, because the health system is at risk, and keeping people safe is at risk, and lives are at risk.
Thank you, Ms. Sutherland. Erica Butler, CMHA, Sackville.
Thank you, Bruce. So, like my colleagues, and I apologize if this sounds like it's echoing some of the other questions, but I'm hearing from people concerned that the new orange has tightened up on the household bubble, going from 2 households to 1, and then at the same time loosened up on business and recreation settings. So I'm wondering if you can break down some of the numbers that might help explain the rationale behind that. Like how many cases are coming from informal gatherings with friends and family versus how many are coming from settings like retail shops and restaurants?
I actually have some information on that, Erica. And again, throughout the pandemic, we've always been trying to reduce risks as much as possible. In a pandemic with a virus like COVID-19, the risk will never be zero. And protecting people's mental health, protecting people's businesses, protecting the schools, the economy, and the hospital workers and the hospital capacity, so that people can not only get treated for COVID if they have COVID, but they can also get treated for other things, because we do have an elderly population here. We do have a lot of people with chronic diseases, and they need treatment. They need elective surgery, urgent surgery, et cetera. And when the healthcare system is overwhelmed, we can't continue with offering those types of services. So what we're seeing in terms of the types of outbreaks and transmission in the various types of outbreaks that we've seen so far, many of them are as a result of people gathering in private places for private functions. Informal gatherings of any kind have contributed to a lot of the transmission. With respect to businesses, I know for a fact that there have not been a lot of scenarios where transmission has happened in businesses, et cetera. That doesn't mean to say that we might not still see a lot of that type of transmission in the future. Certainly, my understanding from the Department of Public Safety is when they've been doing inspections about people wearing masks, they've had quite a good compliance with mask wearing. But prior to the outbreak in Zone 5, that wasn't the case, and that's why we've made changes around mask wearing. We know how important that is because we were seeing transmission in workplace settings between employees, not when they were working with the public. When they were working with the public, everybody was following the public health guidance. But when they were working with each other away from the public, or where they were having lunch breaks, et cetera, that is when we were seeing transmission. We are also seeing transmission for people who work in different types of settings who are going to work with symptoms and not getting tested. So we know that's a problem. So we're trying to address that as well, again, with messaging around making sure you get tested even if you have mild symptoms. So with respect to Region 1 and Region 2, I do have all of the outbreak patterns of transmission. There are still some cases related to travel outside of the Atlantic bubble and international travel as well. But most of them I'm seeing are private gatherings at this point in time. And so that is why it is so important that we limit our close contacts. When we talk about doubling time, and there was one reporter who asked a question about, well, it was only 14 cases, and why is that such a big deal? Well, exponential growth in cases is very dangerous in terms of the effect that it can have in a very short time on the healthcare system. For example, in the outbreak in Zone 5, there were upwards of about 80 plus cases, but when you did the breakdown of what percentage of that population would need to be hospitalized and what percentage of that population would need ICU care, you can break down what those percentages are, and you can model what the hospital capacity will be and how many cases it will take to actually overwhelm the system. And it's surprising how fast that can happen. It can happen in a matter of days. So we don't have the luxury of messing around. We don't have the luxury of waiting. We don't have the luxury of taking our time and humming and hawing. We have our triggers. They're there for a reason because it is very, very, very important that we, again, protect our healthcare system from becoming overwhelmed, and it can happen in a very, very fast time frame. So if we have 14 cases today and they double, that's 28 tomorrow, and let's round that to 30 because it makes the math easier. And then if that doubles again, that's 60, and if that doubles again, that's 120, and if it doubles again, it's 240, and if it doubles again, it's, you're up to 500 cases in a very short time. Well, we know the breakdown of that 500 would be 20% will be very ill, 15% will require hospitalization, 5% will need ICU care, and a certain percentage of those will pass away. So we know the math, we know the modeling, and we know how important it is that everybody do what they need to do immediately to get this under control so we can go back to the yellow phase as soon as possible.
Thank you. Thank you, Doctor. Thank you. Isabelle Legier, CBC.
Hi, yes, question is for the Premier. What happens to people who are being evicted in regions that are at the orange and red level? Does the government have plans to protect tenants from having to find new places to live when they're supposed to be staying at home?
So your question was what happens if it's at the orange level and they're evicted?
Yes.
And we have cases, we have situations where that is happening?
If there's any guidelines in place for the government to protect these tenants, if that were to happen?
Well, right now, we had, at the beginning here, we had when people were losing their jobs, when people were not able to pay their rent, we had mechanisms in place. So I'm not familiar with cases where because, a situation, we've gone to a different zone. That's why, we're trying to keep schools going, we're trying to keep businesses open so people's employment continues. And the health rules continue to be followed, but yet their economic activity continues, and that's what was different at the very beginning of the pandemic. So right now, I'm not familiar that because of going to orange, we're going to see any significant changes in certainly evictions within apartments.
Can I correct that? Sorry.
Sure.
Within the orange phase, as people are supposed to be staying home, is there any way, not necessarily that this would cause evictions, but if an eviction were to happen in this phase, is there any policy or guidelines in place by the government to protect those tenants?
No, not at this time. That would particularly related to a situation, but I'm not sure why that would cause an eviction. There would be other circumstances causing that eviction. It wouldn't be related to it being an orange phase, and so I don't believe there'd be anything in place at this stage that would change that as a situation.
Thank you, Isabel. Tom Bateman, Times and Transcript.
Good afternoon. I've got a question about the communication of the protocol related to COVID-19. Premier, you noted that there's a lot of information about the measures that people, especially in zones 1 and 2, need to take. Some of it's changing. We heard today from leaders, from other political leaders, who think there needs to be, a more comprehensive communications plan, perhaps consideration given to people who don't have internet or Rogers TV that would allow them to watch these briefings. Are you monitoring how well New Brunswickers are understanding what you're asking them to do? And do you think that there's any changes required to how these requests are being communicated? Thanks.
Well, actually, the polling that we'd previously done, the communications and the effectiveness of it were received very, very well. I mean, we're up in the 90s, I think, even. So I don't have a recent stat on that, but I think overall it has been received quite well and accepted around the province that the message is understood. I think of late, though, to your point, some of the cases where we've had to move back and forth from a yellow into orange, and probably of the most recent, like yesterday, in the case of, in the last few days, maybe even announcing that some of the changes had made in orange. So in other words, we're allowing the hair salons to stay open. Well, in the past, that wasn't there. We're allowing some businesses to keep running, but all of them have had an experience now with COVID. They've had protocols set up that have been approved in their operational plan. And so that gives us the flexibility to kind of evolve as they have evolved. And so managing the risk becomes different now than it was when we first started back in March. So I think there may have been a little confusion this last few days about how the colors had changed a little with different things, and I could use those examples. But overall, I'm not. It's very clear on the website, and we're also putting out different informations. I have had suggestions that we could put out different alerts, maybe in print, so that if something changed dramatically, it could be an alert function, and then we're looking at that. I'd like to think we're going to see less of this and more, but unfortunately, the last few weeks haven't borne that to be a reality.
Thank you, Premier. Thank you, Mr. Bateman.
Sorry, I have something else to add to that. So you raise a really good point, Tom, and we have actually learned through the outbreak up in Zone 5, we are now doing community engagements with MLAs and mayors of the different places where we have to change phases. And when we did our engagement session up in the Zone 5, what we learned is that you're right, there are people who don't have internet. And so in that particular case, because we had imposed the orange phase protocols and they still weren't quite, we weren't seeing it reflected in the transmission patterns in terms of changes, and we weren't seeing it reflected in the case numbers. So we were taking extra steps to find out what else needed to be done for communication. So we did quite a blitz with respect to local media and also some printed materials for that community. And then our last community engagement session that was done in person was down in St. Stephen. And again, when you're engaging the community leaders, they know their population very well. And so we're accessible to those leaders, whether they're MLAs or mayors, to be able to find out what their needs are and stay connected that way. And then with respect to this recent, the issue for today with Zone 2, we also have had conversations with the community leaders to let them know what was happening. And we do have, in conjunction with public safety, we do have some more community engagement sessions planned for around the province in different communities. So I do hear what you're saying, and it is really important that everybody understand that not everybody hears information in the same way. The targeted audiences are different age groups. And so in the Zone 5 outbreak, there certainly were many elderly people involved who would not have access to internet and things like that. So the printed material was really important. The radio, local media interviews, et cetera, and local newspapers, et cetera, was really important and key. And we keep learning from these situations, and we'll keep taking that information into account. But again, I think that the engagement with community leaders in terms of understanding how it is that we can help them help their communities in outbreak situations and get back to the yellow phase as quickly as possible.
Doctor. François-Pierre Dufault, Radio-Canada.
Bonjour, ma question est pour Dr. Russell. Est-ce qu'il y a eu dans la zone 1 ou la zone 2, que ce soit Saint-Jean ou Moncton, des grands rassemblements, peut-être des jeunes adultes, des adolescents? Est-ce qu'il y a eu des rassemblements comme ça qui sont pour vous source d'inquiétude, qui auraient pu mener à des amendes et qui auraient pu avoir un impact sur le retour de ces deux régions-là en phase orange maintenant?
Alors, c'est beaucoup de choses qui sont impliquées dans les éclosions. C'est pas toujours une seule chose qui arrive, c'est plusieurs choses. Alors, peut-être c'était un petit rassemblement et après ça, un autre rassemblement et un autre rassemblement. C'est ça qu'on a vu dans la zone 5. C'était plusieurs petits rassemblements, mais à la fin de la journée, il y avait 80 plus cas qui étaient impliqués. Dans la zone 1 et 2, c'est une combinaison de différentes choses, mais les rassemblements, ça pose le plus grand risque à ce moment-ci. Alors, c'est le plus important message aujourd'hui, c'est les rassemblements sont vraiment un risque qu'on ne veut pas avoir ici. Et je crois que si on avait des rassemblements cet été, on était bien. La situation dans les autres provinces était bien. Il n'y avait pas des grands nombres. Mais le problème maintenant, c'est qu'on n'a jamais pu dire au public que le risque serait jamais zéro. On n'a jamais pu dire au public que le risque des cas de COVID d'entrée ici à notre bulle atlantique serait zéro. Le risque était jamais zéro. Mais c'est plus élevé maintenant parce que tout alentour de nous, en Maine, dans les États-Unis, dans les autres provinces du Canada, Manitoba, Saskatchewan, Québec, Ontario, Alberta, Colombie-Britannique, il n'y a pas un endroit au Canada qu'il n'y a pas un record de nombre de cas, un record nombre de gens qui sont hospitalisés, un record nombre de décès. Et c'est prévenu que d'ici à la mois de décembre ou janvier, ça va être 60 000 cas par jour. C'est incroyable ce qui arrive en dehors de notre bulle atlantique. Et le record des cas mondiaux et les décès mondiaux, ça augmente chaque jour. C'est incroyable. Alors, les risques en dehors de la bulle atlantique sont tellement élevés. C'est impossible de diminuer le risque à zéro ici dans notre province, dans la bulle. C'est pour ça que c'est vraiment important qu'on diminue notre risque par diminuer notre bulle, le nombre de contacts étroits, etc. C'est très, très, très important à ce moment-ci. On n'est vraiment pas dans une situation qu'on peut gérer facilement si nos hôpitaux n'ont pas la capacité de gérer la situation. Alors, c'est pour ça que les messages sont très importants pour le public, pour comprendre et suivre les directions de la santé publique à ce moment-ci.
Merci, docteur. Merci, M. Pierre Dufault. Paige Woodard, Miramichi Leader.
Hi, my question is for the Premier. I'm wondering if you're aware of the petition that was recently launched by the MB Coalition for Pay Equity, asking for increased funding for transition home workers who were deemed essential during the pandemic, and if you plan to increase their wages or further funding, and if not, can you explain the reasoning behind that?
Actually, we have a plan that was identified a year or more ago in relation to improving the wage levels, and that was our focus for home care workers and daycare workers to raise their wages up. And I think the target is for $19 an hour, and that's been on our radar right from the very beginning.
And specifically, I'm looking at the transition home workers. That's who this petition is asking for a pay increase for.
The transition. So what area of workers?
The transition home workers.
Yeah, I would think that they would certainly be in the same situation, but I haven't looked at that directly at this time, so we will understand that further.
Thank you, Ms. Woodard.
That concludes today's COVID-19 update for New Brunswick with Premier Higgs and Dr. Russell. Just to recap, Zone 2, the St. John region, is now rolling back to an orange level of recovery. If you do live in southwest New Brunswick, particularly in Charlotte County where we are based, that does include us. So I recommend going to gnb.ca/coronavirus to find out what the new guidelines are for orange level. They have been modified since last time, with certain new things such as hairdressers can remain open with new guidelines in place. So I recommend checking that out. We'll post them on our Facebook page as well. Also, follow us on Facebook if you're looking to find out when the next update will be. We do post as soon as we know when one is scheduled. We post it on our Facebook page to let you know, especially if the time is different, such as today where it started at 3:30. And just to recap as well, there are 9 new cases today, 2 in Zone 1, the Moncton region, 7 in Zone 2, the St. John region. I believe there are 51 active cases currently in the province. And again, Zone 2, the St. John region, is rolling back to the orange level of recovery at midnight tonight. That includes southwest New Brunswick. Stay safe, everyone. We'll see you next time.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.